can hear you thinking.
I can hear your thinking too.
Fabulous.
We don't need stethoscope for that, do we?
We don't.
We don't. Welcome to the show. This is Soulstar Radio with Jacquelene, and Dr. Anthony is back in the house. How are you today?
I am very well, thank you. A beautiful day here in Whittlesea, 22 degrees, and the sun's out.
It is.
Welcome to spring.
It's rather interesting times. We're in spring in the Southern Hemisphere, and hello, happy fall in the US and the Northern Hemisphere, where it's, they haven't done the time zone shift yet, but we have.
Right.
We've done the time warp again.
Yes, we're forward thinkers.
We're forward thinkers today.
Yes, we fell forward, they go backwards or something. I don't understand the time shift, but that's okay. Nice to have you here in my clinic today, Jacqueline.
Very good to have you on the show. So now we're going to do a bit of an acupuncture consult, and we're going to talk about spirituality, and we're going to take calls for readings.
We are.
Dr. Anthony can hear things in your voice, usually because you're talking about the different elements and the sound of the voice.
We listen over here. Under the 5-element world of acupuncture, Jacqueline, we listen to the tone of the voice, and we're looking for weeping or singing or sadness. And it's one of the key factors of determining the element of a patient is the tone. It's about smell, sound, and odour. And so we're listening to the tone of their voice and how the person actually talks.
Or plays with a stethoscope, as it might be.
Or like you pinches my stethoscope and has a play.
It's a hyperactivity, you see.
Correct. As my grandchildren do.
We're of one mind at the moment, at least, because we've swapped stethoscopes. So it's all happening. So let's just pretend for a moment that I'm a patient, which I actually am sometimes patient. But,
yes.
So how would we proceed with a Chinese medicine sort of treatment?
Sure. So basically there's an 8-page questionnaire that the practitioner fills in during the consult. And it always starts off with, what's the patient here for? What's your chief complaint? And 9 times out of 10, Jacqueline, a chief complaint turns into 8 other things. So we just listen, we let the patient talk. What brings you to my clinic today? And they say, look, I've got a sore shoulder. Okay, anything else? Yeah, my right knee's giving me grief.
I'd like to kill my husband, except I can't.
That does come into play.
Yes.
That does come into play. And then when the patient's finished, you can see they're all hepped up at the start. They just want to get their info out. So you let them go, let them talk. Then you write down the dot points, and I take them back through each point. We talk about, the location of the pain in the shoulder, the duration, what treatment have you had so far, what's worked for you, rate your pain out of 10 today for me. Then we talk about everything else that happens. With women, it's often menstrual issues that we treat. So then I ask the patient, well, what of all that you've told me today is the most pressing thing for you? And 9 times out of 10, they'll say, look, it's my shoulder. We can control the menstrual cycle later. I'm not sleeping well. I have some issues at home, elevated stress, partner issues. All that comes up in the 20, 25-minute written consult. So then we do the diagnostic stuff. We take them through what's called 10 rhythmic questions about excess deficiency. Are they hot? Are they cold? Do they get dizzy? Do they get heart palpitations? Then I go through their diet. Then I go through their sleep pattern. I focus a lot of my time on their sleep, not so much about what time you go to sleep. I'm more interested in, if you wake up during the night, what time do you wake up?
Yeah.
Is it just to go to the toilet, or is it you just wake up at those times? Because waking up between 1 and 3 a.m. is the chi moving to the liver channel, so that's element of stress, and 3 to 5 it goes from the liver to the lung, and that invokes grief.
Yep.
So being in a bushfire-prone area, for which we are here in Whittlesea, most patients 1 to 5, that's when they wake. It's the stress elevated with grief. So they're not sleeping from 1 to 5 in the morning. So, of course, we do acupuncture points, Shenman Heart 7 here on my wrist, PC 6 is another one, bladder 11 on the back, the base of the neck, bladder 43, 44, 45 down the side of the scapula. They're my go-to PTSD points.
Yep.
And you can actually see them on a sufferer of PTSD. The points actually raise and they look like my knuckles, and you can actually see that in a patient. And when you palpate it or touch them, the patient actually, what's that? And I go, that's your blockage. That's the emotion blocked in the bladder meridian, blocked in your back. And I treat a lot of bushfire victims here. And there's one particular young man I treat all the time. He knows when he needs to come in for a visit. He relapses. He doesn't sleep. He comes in. He doesn't say a lot. He doesn't have to. You don't have to speak a lot when you're treating these pill guys. Within a minute of me needling the PTSD points and bladder 11, he bursts into tears and he'll cry for 30 minutes.
Yep.
Face down on the bed, he'll just cry and sob. He had a horrific loss during the bushfires, unimaginable loss.
Yep.
A loss I don't even know how that feels. I haven't experienced that kind of loss he has. He'll cry for the 30 minutes. We take the needles out, we do a bit of a back massage, and off he goes. And he's fine for the next couple of months.
Yep.
So I do focus a lot on sleep patterns. And then we talk about dreams. I don't do dream analysis. Patients ask me that. I have no idea. I ask them to actually interpret their own dreams because they're the best at interpreting their own.
It is, what does that symbol in the dream mean to you normally?
Right, that's a good question.
How did that make you feel? And, what's the sort of urgency in that? What was the most important part of it? Those are the sorts of questions, but it feels like you're asking those anyway.
Sure. Now, the other thing they tell me, and I know it's a normal human trait, is they don't remember dreams.
Yep.
What about the patient that remembers a horrific one all the time and actually can't unlive it?
Why am I wanting to hit the inside meridian on the right-hand side of the leg around about here?
Spleen 10 or liver 9?
I think I'm hitting both.
Yeah, so it's in the same area. So spleen is chi and energy and liver is stress and worry. So, yeah.
It looks like it's brown when that's happening.
Yeah.
So to me, it's like some people have recurring dreams because there's a psychological block and there's something I haven't been able to deal with in the waking hours. Some things can only be dealt with in the dream state.
Right.
Because we're having to clear the energy. Yep. And some people like myself, we can actually go into a dream and go, and play and change the dream. And you can actually psychologically shift things that way. But there can be situations where that can actually be damaging. It really depends on, I guess, the individual and how they're treating that. But certainly PTSD is a massive thing in this area. And straight after the bushfires, like yourself, I was up there helping people. And, and in a lot of cases there was the PTSD residing with them, but then there was a PTSD starting to reside with a lot of the therapists, the first responders. I know that myself, I couldn't handle helicopters going overhead for about 2 years. And I had to have all my notes in my wallet organised according to the KFC manager's way of counting them, which is smallest denomination at the front, largest denomination back, perfectly faced. Couldn't leave the cashier counter until I had done that, which was very frustrating for tellers, I can tell you. But, that was because I went back to that safe place of when I was a manager. Yeah. And you had to, the order in your life was you had to have the notes counted exactly this way and, faced that way and rubber banded and all this sort of crazy stuff. Yeah. And I sort of went back to that place for a while. And a lot of people straight over those fires that were survivors as well, we were playing Farmville. Remember those sort of days we were all on Farmville. I was like, what's your score at the moment? It's like, I got a cherry tree. I got a windmill. Because it was this regrowth of life on a computer it was a completely useless waste of time for the mind to actually distract you from what was really happening, to actually disengage for a while and then re-engage. And so it's had a big effect on the whole community. And a lot of people have really come together, as a result of that. Other people have just moved right apart. It's just a permanent change that's happened as a result of that. Mm-hmm. But it can have those long-lasting effects, and the dreams can be part of that, most definitely. Right.
So back to the consult. So we go through the sleep pattern and we take a detailed previous medical history. Yep. We need to know what they've been through, hospital stays, etc., operations. Then we go through their drug history, which is very important. We need to know if you're on blood thinners, on heart medication. We need to know if the patient's HIV positive. It's a very important question I do ask. Then we move on to bowel motions, urination, how many times a day do they go? We talk about their parents, if there's any health issues, because there is hereditary traits, but not all of them come from parents. Then we move into the medication, as I said. Then we talk about a treatment plan. But before we get to that, we actually look at the tongue. We do diagnosis through the tongue, where the patient can stick the tongue out.
I just had Minties.
Yeah, you have. So we look at the size of the tongue in relation to the size of the patient or the patient's mouth, so it's the proportional size. We're looking for the colour of the tongue. We're looking at the coating of the tongue, and we're looking at the shape of the tongue. And within a few minutes, you can, a patient just has to poke the tongue out quickly and can do it. It's not, they don't have to leave it out forever. I have a bit of fun with my patients. I tell them, poke your tongue out, a little bit less attitude next time, thanks. Just have a little laugh, just to take the stigma away around poking tongues out. I find it interesting that the elderly population are very reluctant to poke their tongue out because I tell them, Mum's not here now. It's okay. I know you're 80, but you're allowed to poke your tongue out.
Yeah.
Some religious beliefs won't allow that to happen, and they'll hide their tongue from their partner if the partner's in the room with me, and so I can do the diagnosis. The next thing that we do is we take the pulse in 9 positions on the wrist, 1, 2, 3, 1, 2, 3, like this, and then where's the camera? So 1, 2, 3, and then 3 down. So superficial, medial, and deep. And we do that on both sides, and that tells us what the heart, liver, kidneys are doing, the lungs, stomach, kidneys are doing on both sides. And we're looking for, we spend a lot of time learning pulses at university, and we're after, we feel the bead, we feel the pulse. We don't count. We used to at uni. I don't do count anymore. We can confirm pregnancy through taking pulses. And with that, we formulate a treatment plan. I do a diagnosis of deficiency, excess, work out what meridians are involved. Then I sit down with the patient. We write down a series of acupuncture points. I have a model. I show them there's 365 points, 12 main meridians, 2 extra meridians. And as a laugh, I go, I don't needle 365 needles because that's ridiculous. I have heard practitioners doing numbers that high, and the body can't handle that.
No.
The body actually goes into a complete collapse and a patient will actually faint. And then I ascertain their attitude towards needling. And what I mean by that is, do they have a needle fear? If you do, well, I need to know because I can hide how I work. I can trip your mind up so you're thinking you're not having needles when I've actually done them.
Yep.
I do use 0.18 mil of in diameter needles. I use very fine needles, and it happens so quick they don't even. I say to them, if you feel any one of my needles, I'm doing it wrong.
Yep.
That's the difference with dry needling. They use a thicker gauge needle, quite aggressive with the way they needle, and they'll stimulate and push the needle in and out.
I think it's strange that they do 8 hours of training.
Oh, absolutely.
And yet they're trying to tell very spiritual people who are very aware, but also very anatomically aware that they've trained in university for 5 years and 2,000 hours of supervision, practice. And they're telling those people how to do this.
And that's the frustrating thing we find, because they do lack a lot of needling skills. Like I would have gone through 1,000 needles just to learn my technique of insertion.
Yeah.
Before I even touched a patient, I just practiced. I used to needle the carpet.
Yes.
I'm a floor sitter, so I just needle the carpet to get that technique right. And then people today ask me, how do you get the needles in pain-free? It's just getting it in through the pain barrier as quick as you can.
Yep.
Sidetracking the mind a bit of the patient. Don't let them focus on what you're doing. Don't go, right, you're ready now, we're ready to go. I mean, I can show you here, but we won't. Maybe you've got a lady waiting to talk to you. So then we go through I always tell my patients to give me at least 3 goes. Your condition, what I'm saying there is we need to know if the patient's going to respond to acupuncture.
Yeah.
And we'll know within 3 treatments if the patient is. So what we do is by the 3rd visit, we assess what we're doing. And if there's no measurable response, then we go, well, acupuncture's not for you. You need to find another modality that will actually help for you.
You get some very spiritual kind of energetic things happening as well, and you're having to work within the professionalism of traditional Chinese medicine practice, but that doesn't stop you from being an intuitive person as well.
No,
so it's sort of an interesting blend, isn't it?
It's very much so, and a lot happens in the treatment room that you wouldn't actually talk outside a treatment room. And I often go back in and they'll say, well, I've got a blood spot here. I actually didn't needle that one today.
We know who did.
Someone else has done that for us. But it's all positive and great stuff.
Yeah.
I'm treating a young man at the moment with a serious back issue, and every time he's in, he feels someone adjusting his back for him.
Yep.
We don't adjust. It's out of my scope of practice. But he feels the pressure on his back. He feels amazing when he comes out. He's waiting for an operation to have his back straightened. But we do have some very exciting things happen within the clinic, the realms of the room.
I know that one particular person, I actually did healing and energy, because I do energy healing as well as the readings. And I actually had a Vogel crystal, and I worked on this person from 3 meters back. Did not at any point touch them. And I did this thing that I can do, because I've got crow animal totem, and you can be multiple places at once. And so I sort of did what I did, and I was way back, did not touch him. And then I thought, I'm thirsty. I think I might go out and have a glass of water, just very quietly. And so I set the energy up, and I very quietly slid the door back, walked out, had a drink of water, still I've got the energy tension going, the healing's happening.
Yeah.
Come back in very quietly, and then I go, oh, well, that's a lot more shifted. Great. Okay, well, I'll close him up now, as you might call it. And and I said, oh, there you go. And how did that go? Oh, who are the 5 other people in the room? And, you're all touching me.
Yes,
and la, 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 la. And you're like, oh, I can't tell you.
No.
I know that when I've had acupuncture treatments with you, we laugh about Lishu Zen coming into the room.
Yes.
And he actually at times has treated me while driving the truck on double lines over a crest. Thank you very much. Telling me he doesn't have time because time is precious. That's what his name actually means. And he's got other patients to see. Pull over, you'll need to. And I'm like, I'm on double lines going over the crest of the hill. What do you want from me? Next thing, poof. And you're like, and the head hits the ceiling. And then I come back and I tell Tony, and he goes, that was that point. And you go, oh, that's exactly what was physically happening. So sometimes it's more than what's happening in the room, and that we can actually, as professionals, have you talk about.
Sure.
But what we can do today, we've got Lindsay in Jackson, Michigan. Are you there, Lindsay?
Yes, ma'am.
Hello, and thank you for joining us on the show.
Can you hear me?
Yeah, we can hear you, darling. Can you hear us?
Yes, I can hear you.
Fabulous. So if I can start with your date of birth at all, that would be really great, and I can start doing a reading for you, and we can have Dr. Anthony come in with what he's picking up as well.
Okay.
We just need your date of birth, if that's all right.
I'm very sorry. I didn't quite catch what you just said.
Just your date of birth, if we can. I can start doing that reading.
You're ready? Yes, I'm ready.
Okay. All right. So what I'm really picking up from you, Lindsay, I feel like it's a bit of a conflict at the moment in trying to work out the direction of what you're having to do, and particularly being able to voice yourself at the moment. It's a bit difficult getting that happening. What I really pick up with that as well is it's like you have to pick through the issues one step at a time here, and it's like prioritise things out. So it feels like we've got a lot of different things on our mind, hitting 3 different areas of your life, and it's like, well, which part do I start with first? And that's what I'm initially picking up from you. And it's like you need to take things one step at a time at the moment. You can't really push ahead beyond what you're dealing with, in those, like taking it in small chunks help you deal with it easier, because if we try and take it all on at once, it becomes a bit of a clouded issue, if that makes sense to you.
Yes. I'm kind of in a spot right now where I feel like I may not be doing enough, but I'm also trying to stay in alignment and in that space of allowing. And a lot of it has to do with like my career and my living situation. So that does make some sense.
I really would be breathing into that and actually sighing it off your chest. It's like you can't really say the things that have actually been concerning you to some of the people around you. It's like it's just a heavy weight there. And I see a lot of that grey colour and energy over top of that. I do feel the clouds will clear, but you are literally having to just take this one chunk at a time, one spot at a time, and you can't really push too much of anything at this stage. You have to literally do a lot of allowing of your energy, not so much allowing of other people being quite demanding so much. I feel as if with the career, it's like it's, a heavy slog in some rather heavy boots, so we can feel heavy in the legs and the feet and having to really ground yourself, but we can feel a bit stuck in things, a bit bogged down in things with that. It's not ideal at the moment in that environment, but it's like it's important to just literally take this one step at a time in that particular arena, in the career arena, because you can't really outpace what's happening there anyway. And I do feel that in the next, I'm just not sure if it's 6 weeks or 6 months, there's a rather large change in that work area, and it's like you're able to do other things, able to reorient yourself here, and able to have other opportunities that are actually a lot lighter and a lot more, fulfilling and a lot less, oh, my God, what am I doing here, is what I'm really getting from that. Yeah. What were you getting there, Tate?
Well, basically, I'm feeling she's being very hard on herself and not to be that hard. Mm-hmm. And it's not your fault.
Yeah.
And it's okay to be upset. Mm. It's okay to cry.
Yep. Yes, it's a grey over there. So that's that metal, isn't it?
She needs some heart nourishment stuff. Poor girl. Yeah. So just don't be hard on yourself, Lindsay.
Say that again. I'm sorry, sir.
Don't be so hard on yourself.
Yeah, I am. I'm in a space right now where I'm trying to learn how to just be kind to myself, and I have a bit of I'm a bit of a perfectionist, so I really try to give myself a little bit of a break, because I do, if it doesn't turn out, because I do hair, I'm a hairstylist, so you do your best to encapsulate what somebody is wanting, and you feel like sometimes it's not the best, like it's the best haircut you ever put out, or you know what I mean. So I do spend a lot of time picking myself apart, and I'm certain that does not keep me in the vortex, and it does not keep me in alignment. And I'm really good though at redirecting myself. That makes sense.
Yeah, I'm totally getting that. There's a lot of punishment there. It's really important when you've got a client that's being less rational, we might call it, being really polite right now, to maybe, and I think you've been working on this, be a lot more clear from the beginning about what their expectations are and what, is reasonable and rational, and being able to keep within a real clear, maybe verbal contract from the beginning, what we will be doing today, where the limits of that are. I think sometimes you can just be down on your luck with some people, and sometimes there can be kind of a similarity in their treatment of you as to what you have experienced in the past, possibly from mother, that, you need to kind of do the healing on, if that makes sense. Because, I was getting all that grey and that metal kind of stuff coming off the heart and our heart-lung energy.
That's grief as well.
It's the grief in there, I'm feeling, and the anger.
Yeah, it's very much so.
And that's my heart chakra, I have blocked for a really long time. So it is finally nice to be able to feel again, if that makes sense. Like, yes. I kind of challenged that over to where I wasn't able to really feel.
Yeah, it's something to keep working on. And I'm wondering about tapping in this area.
Yeah, that'll work. Just clear blockages.
In the thymus sort of area.
Thyroid, do Tarzan.
Tarzan.
That's the best way to stimulate that one.
That can get that going and help you with that heart clearing, but certainly keep doing the work on it. It's really important because the more you do work on that and the more you keep putting that love back into you, it comes back reflected to you through better clients, which you'll notice you're getting better clients or you're getting better experiences with people. But it is just this having to turn the energy around. It can take a while, but it's certainly worth it. But it's really important not to punish yourself. Really important.
Okay.
I hope that helps you. Yeah.
And I was going to say, you need to take some time for yourself, Lindsay.
Yeah.
Stop giving out so much and look after you.
That makes sense. And then,
absolutely.
So even like the living situation, like I had a place lined up and it fell through. And now
2 months.
I'm back at like square zero. I'm not exactly sure what's going to happen. I try to wake up every day and tell myself and allow myself
2 months,
something incredible is going to happen.
Within the next 2 months, there's a complete shift in your living surroundings, an environment that will actually benefit you greatly. And at the moment, stop looking for now. But in the next 2 months, there's a massive change on that front, and you'll be able to breathe a lot clearer, and it's like a lot more freedom there. But it's going to take 2 months, apparently. That's what I'm getting from this. And we thank you very much for your call. And it's been wonderful having you join us again, Dr. Anthony. We've run right to the end of the show here.
We have. Thank you for having me on again. Thoroughly enjoy our times on radio.
Absolutely. You'll be back next month, God willing, and with our service coach, we'll be kind of, tuning in.
That's better. That's better.
Oh, there you go. Bye. We'll catch you next week. Have fun.